So the incidence of chronic pain in the United States is increasing over the past few decades. In fact, almost 50% of Americans have some form of chronic pain, and almost 20% have high-impact chronic pain. Yet we have only one interdisciplinary pain program for every 670,000 people in the United States. So there's a big mismatch between where the population is going in terms of the incidence of chronic pain and the numbers of programs we have to treat them. And there's a lot of major guidelines that have come out over the past number of years that endorse interdisciplinary treatment for chronic pain. They're very safe and they're moderately effective. The CDC opioid guidelines endorse them. VA DOD guidelines endorse them. And then the U.S. Department of Health and Human Services actually has a statement saying that we shouldn't treat patients with opioid treatment long-term